Leontiasis Ossea, also known as big head disease, is a consequence of untreated hyperparathyroidism believed to be caused by elevated levels of fibroblast growth factor 23, as well as other growth factors and cytokines due to parathyroid hormone excess. This report depicts a 28-year-old African-American woman with Leontiasis Ossea, secondary to hyperparathyroidism from ESRD. This unique complication illustrates the consequences of untreated secondary hyperparathyroidism. This report characterizes a patient with medication and dialysis noncompliance. This patient began noticing throughout the first year of being diagnosed with ESRD that some changes began taking place on her face. Objective. The purpose of this report is to understand, identify, and manage this rare consequence of hyperparathyroidism known as Leontiasis Ossea. Case presentation. A 28-year-old African-American female presents with a case of anemia of chronic disease secondary to idiopathic end-stage renal disease. The patient was advised to begin treatment with cinacalcet, vitamin D, and sevelamer, however, was not compliant. She began to notice pain in her joints, an altered facial structure appearance, and generalized weakness and lethargy. She described rapid expansion and growth of her mandibular and maxillary bones, as well as gaping of her mandibular teeth. The patient was diagnosed with elevated levels of PTH, as well as brown tumors that were found on X-ray imaging, known as osteitis fibrosis cystica. The treatment plan was parathyroidectomy for the resolution of the hyperparathyroidism. The results of treatment resulted in resolution of the hyperparathyroidism as well as gradual improvement of Leontiasis Ossea. The results were documented over the course of 1 year through photography. The patient provided images comparing the significant gradual decrease in the size of her mandible after having the parathyroidectomy. In image 1, one can see that this was prior to the parathyroidectomy. You can appreciate the dramatically sharp borders of the mandibular bone with its wide margins and broad angles. In image 2, which took place approximately 6 months after the parathyroidectomy, one may appreciate the gradual decrease in the angles and narrowing of the mandibular bone. In the final image, which took place 1 year post-parathyroidectomy, there was a significant decrease in the mandibular expansion. There has been other cases of Leontiasis Ossea that have presented in animals such as horses that also suffer from hyperparathyroidism in similar pathophysiology. In conclusion, one may use this case report to reflect on the management of a patient with a similar disease presentation. With the assistance of evidence-based medicine, a combination of both medical and surgical management has proven to revert the facial bone defects caused by excess growth factors. One may also take away the importance of proper patient compliance with medical management to prevent adverse events. Thank you.